Okay, this is the Mass Health Enrollment Program. So, basically, Mass Health is a free insurance program, and the purpose is to provide a user-friendly and streamlined means of enrolling in affordable health insurance for individuals who struggle with disabilities and other various debilitating conditions which compromises their ability to support themselves independently, financially, professionally. The population that this most directly affects would be individuals and families who cannot afford paid health insurance and would be in a position where they need to rely on state-funded public health insurance in order to afford medical care, basic expenses, and specialized care programs such as service providers for disability and mental health. A person can enroll by use of a computer in order to access the website and complete the enrollment process in digital form. Alternatively, they can use a telephone to contact the Health Connector in order to enroll with the assistance of a representative. The insurance that is provided is intended to be free, which makes Mass Health a favorable alternative to spending any time without health insurance coverage. In Massachusetts, there is a tax-related fine associated with the state of being without health insurance, and that provides a substantial incentive to make use of Mass Health. So the problem with this policy is that it's fundamentally flawed because of its reliance on technology. The people within the target population are often in a position where they will either not have access to the technology required to enroll in Mass Health, and they also often lack the technological competency to properly make use of these these technologies on their own without the assistance of family members or caseworkers. Now, the reason that this policy is ineffective for helping the target population is that, according to Psych Central, the average IQ is around somewhere between 85 and 100. Individuals with disabilities, particularly developmental disabilities, will often have an increased amount of difficulty with navigating the technological and bureaucratic obstacles associated with enrollment due to having a lower IQ than what would be required in order to navigate these programs independently. So consequently, a lot of people in the target population have to rely on the help of either family members, friends, or caseworkers and other human service programs which are intended to assign staff to provide assistance. I did a lot of this when I was a caseworker myself. So the innovation is that I think that one obvious improvement would be to increase the funding and the budget allocation, which would be put towards state-funded service providers which provide individual supports and caseworkers for the developmentally disabled population. In my own experience working as a caseworker, a lot of what we do was taking care of basic responsibilities such as medical appointments and navigating things such as insurance and scheduling and subscriptions and medication and stuff. One of the organizations that I worked for which I'll use as an example, the ARC of Plymouth and Upper Cape, they, for instance, assign caseworkers to individuals who would be otherwise unable to navigate the kind of technology that is required for Mass Health enrollment. So I think that the most obvious improvement would be a higher allocation of financial resources for these service providers so that they could increase the number of caseworkers who are available. I noticed that usually when these kind of things are overlooked or when individuals and clients are unable to navigate these processes on their own, it's usually because their caseworkers don't have time to attend to everything that has to be done, or that they often lack the training. So the answer to this would be more caseworkers, as opposed to piling more cases onto fewer caseworkers, thus overloading them and not allowing enough time for each individual person in their care. The way that they would evaluate the effectiveness would be the same way that they evaluate the effectiveness currently, which is making note of rises and falls in the rates of enrollment between periods of 3 years. So an increase in the enrollment consistency, the rates of enrollment, would most likely be demonstrated in the statistics if there were more caseworkers available for more caseworkers available for providing the necessary services for the disabled population. In terms of how this factors into the grand challenge of social work, one of the most important core values, particularly important to me, is the encouraging autonomy and self-determination. And that is a big part of this process because in a lot of cases, decisions will have to be made on behalf of a client due to lack of competency and education in the field. And educational services are a big part of what is required of caseworkers, especially when training an individual to take care of themselves independently. So, according to the National Social Workers Code of Ethics, the encouraging of autonomy and self-determination in clients is a very important part of the therapeutic process in this case. So, I think that it would most obviously be reflected there, as well as, guaranteeing access to the kind of services that everyone should have access to regardless of their level of ability or competency. But unfortunately this is very difficult to achieve considering how few individual support specialists there are who are particularly trained in assisting and educating people of this target population. And here are my references.